So it would be really unfair to address hand hygiene and infection control without acknowledging Dr. Agnes Semmelweis, who practiced in the 19th century and was able to identify among two different wards taking care of postpartum women who had very different rates of infections. The first group of women had a higher mortality rate and they were being cared for by physicians. Those physicians were practicing between the postpartum wards and between the postmortem wards, trying to address deaths among women, and were going back and forth between those two areas without performing any type of hand hygiene. While the second group of women, who had a much lower rate of death, were being cared by nurses who only cared for them and were performing hand hygiene prior to taking care of those women. And you can see that Dr. Semmelweis introduced an intervention in 1847 where he imposed on the physicians to perform hand hygiene, and as you can see, a very drastic decrease and drop in mortality rate among those women took place after that specific intervention. And you would be shocked that we're talking now about hand hygiene with very poor rates of compliance among healthcare workers, while this has been identified at least 2 centuries ago. Now, what are other examples of infection transmissions within the healthcare setting? Recently, we've seen during the recent emergence of the new coronavirus, referred to as MERS, in the Kingdom of Saudi Arabia, over 70 healthcare workers got ill with the virus. Many of them, or most of them, were exposed to ill patients with MERS-CoV, and many of those healthcare workers were admitted to the ICU, and several of them passed away. So when we talk about healthcare worker risk, it is a reality. Now, this is another example that I'll try to give you to highlight the importance of infection control practices within the healthcare setting, and that is relevant to central line associated bloodstream infections. This is probably one of the most common interventions that you will be seeing on the wards during your future career. In the United States alone, 80,000 central line bloodstream infections occur every single year. And there are patients who are outside of the ICU with an estimate of an annual 250,000 cases of CLABSI. The mortality rate in the US ranges between 12 to 25%. This is another slide showing the impact of CLABSIs, the prevalence in the different publications by Mermel and Hygine and others, and you can see also that there's a high mortality rate and a high rate in the past several years. Now, this is an example of a central line placement in 2 patients, and you can see a huge difference between the quality of the central line placement and securing it on the patient's skin in the upper left-hand corner versus the second one in the lower right-hand corner, where it looks like there's a lot of blood, clot. Probably the flow and the direction of the central line placement is also incorrect. And unless we address these issues with good infection control practices in placing these lines and maintaining these lines, our patients will continue to suffer from infections. Now, when we talk about infection control practices, they come in different terminologies. And a very common name that I want you to be familiar with is the bundle. A bundle is a group of practices. Usually they are infection control related practices that prevent certain infections from occurring. Central lines, for example, have their own bundle. VAP, or ventilator associated pneumonias, also have their own bundle. Surgical site infections have their own bundle. But let's just focus on one type of bundle. And this is from a tertiary care hospital, where we actually audit the compliance with certain practices that are known to prevent central line bloodstream infections in patients. The first element or intervention is proper hand hygiene. The second one is proper or maximum barrier precautions, covering the patient from head to toe. Number 3 is utilization of chlorhexidine gluconate while cleansing the site for the central line placement. The fourth element is to utilize the proper catheter site. Number 5 is to daily review the need for a central line. And one of the major lessons in infection control, when a device is not needed, it needs to be removed. Extra days of any device, whether it's a catheter, whether it's a ventilator, any intervention or device inserted into the patient is a risk for acquiring an infection. And compliance after that with all 5 elements is reported in such a report. Now, let's move to another type of infection acquired in the healthcare setting, which is NSSI, referring to needle sticks and sharps injuries. And this was a study shown from local data within the Kingdom of Saudi Arabia. Before interventions, this specific hospital or healthcare setting had 33 cases of needle sharps and needle stick and sharps injuries, compared to the post-intervention of 14 with a denominator of 1,000 healthcare workers. Again, this is an element that I would like to highlight to you, because during your career you will be dealing with and you will be exposed to body fluids. And the occurrences of such injuries can take place on the wards, in the OR, in the ambulatory care, during procedures done in laboratories, in the intensive care unit, emergency room, dialysis. Basically anywhere where a sharp is being utilized is a risk for acquiring a needle sharp injury. Now, activities that might lead to a needle stick injury include during the use of the device, while performing a specific intervention, while disassembling the device or the equipment that is sharp, while recapping a needle. And that's why recapping is one of the basic steps that should not be performed while utilizing a needle. Device left inappropriate on the bedside or on the countertop, after use and before disposal, or while trying to dispose of sharps, while placing the item into the disposal container. And there are other activities that can lead to a needle stick injury within the healthcare setting. Now, those were just some of examples, but if we wanted to look at the bigger picture, the risk of transmission of infection within the hospital is quite huge and wide.